Hello Lima, brought to you by Good Food Restaurants, home of Happy Days, Beer Barrel, and Old City Pride. Also by Fresh and Faded, Jones Clark Funeral Home, and Lima Pallet Company.
The leadership of Mercy Health Lima region, including total operations and the growth in the 10-county Lima region, is now in the hands of Lima native Rhonda Lehman. The challenges that come with being Greater Lima's largest employer, along with the high community expectations, a fast-changing healthcare industry, can be overwhelming for the most seasoned leader. We'll hear from this leader managing this environment, President of Mercy Health Lima region, Rhonda Lehman. We'll also hear about a successful program being developed with a local high school and the director of this program, Angel Cowan. But first, let's get to know Rhonda, the impact Mercy has on the community. Hello, Rhonda. Thanks for joining us.
Thanks, Drew. Thanks for having me.
There's certainly a lot to talk about because some of the feedback that we've gotten is what's going on with Mercy and its merger. How is the new training center going to affect Lima with its residence program? What's that building coming up in downtown Lima? I mean, there's a lot people are asking questions on.
Yep.
But there's something, I'm going to start off with a question, though, a comment. You're president of one of the largest healthcare provider in the nation, ranked 20th, I think, in the nation, 5th in the state, in the U.S. in terms of Catholic health charities. It is a big operation, $8 billion worth of revenue. I mean, I find that somewhat unique. And so I'm asking you, and I hope you don't take this the wrong way, but answer me this, Dr. Lehman. Are you really sometimes run with sheep and chickens? Is that a fair assessment?
That is true.
I mean,
that is true.
That's interesting. I mean, you're a talented lady, but tell us, you're from Lima and you do things with animals.
Yeah. Yeah, so the statistics you quoted are for Bon Secours Mercy Health, of which I run one of the markets here in Lima.
And at the same time, you're from this area.
At the same time, I plant a garden. We take chickens to the fair. We raise sheep part of the year.
Yeah, and I bring that only from the perspective, Rhonda, that is so cool because I think Lima is a stronger community when its leadership is from the community.
Thank you.
Obviously a long-time resident of Lima, Allen County, I can go back to when the leadership was sort of raised here. You're a high northern graduate, at least one of the ways you graduate, doctor, and one of the things that you do in this community is that you know where people live and you know how to service the community. So keep it in that frame. Bon Secours, how has that merger affected Lima, Dr. Lehman, as a new president? And you've just taken over, and congratulations.
Thank you.
How do you see that merger impacting the Lima community, and how is your leadership, Rhonda, going to impact the community? I think people want to know what you're going to bring to the table.
Sure. Well, it's a topic I enjoy speaking about because it's one that's near and dear. So when I think about the merger and the part of this larger health system, I think about a couple things. I mean, as you alluded to already in your intro, healthcare is changing in the country, and more mergers are happening throughout the country. And we know that in order to be sustainable and viable, we just celebrated our 100th year anniversary last year, we've got to be in a position to be able to carry us forward the next 100 years. And the way that the trend is going with the healthcare expenditures, really the best way to be able to continue local ministry is to leverage the part of being a part of a large health system. You know, when they look at studies, costs do decline. We see costs decline when we're part of a system.
But having said that, Rhonda, and I know this community, and we have a lot, what we try to do with Hello Lima community perspective, what's the impact? What's the impact in Lima?
And the phrase that I use often, and I'll stick to, is care is always local. So regardless of the name on the badge, the name on the building, which we have a lot of pride in, we love the St. Rita's name and we love the impact it's made. The people that you see walk those halls and the people that you see at the bedside are just like me and you. They are people that are from the community, live in the community, born and raised here, many of them. The longevity is incredible. So what we try to do is bring the benefit of the systemness,
a larger
health system, but not lose sight of the fact that we're still interacting with each other as humans and as individuals, and the things that are important in our community are going to be nuanced against the larger health system.
And certainly keep it in that frame, Rhonda. You being from the community, I can tell you, Dr. Lehman, people are going to be looking at you and say, your mission, and everybody talks about the mission of St. Rita's and the mission of Mercy as it emerges, is to serve the poor, the underserved, the dying. We can put a finger on the dying. Everybody can see that. But how do you measure, Rhonda, the poor in terms of your mission and the underserved? What does that population look like in Lima?
So we do that together. We don't do it alone, that measurement. And that comes from collaborating with some of the other community partners, whether it's the health department or whether it's Activate Allen County or whether it's all of the different groups. We partner and say, help us help each other. Where are these pockets? Where are the people that are most in need of our services?
That is excellent.
How do we do a better job
And
of
I think
access?
that's important. I don't want to cut you off on that, is that you look at other people to collaborate to say, well, it's not just a mission that you hang on the wall, it's how you impact the community. Is that fair to say?
Absolutely.
Can you expand on that? The underserved, Rhonda, where do you find the underserved and how did they know whether or not they're being served? If I was a consumer.
Yeah. So I think the underserved is something, we throw that around that term a lot.
Yes, we do.
But how do we know those are the people we're impacting? So we do a lot of work and we throw around the term access to care a lot. And I think access to care is something that speaks specifically to the underserved. Because it's one thing, and then it's a big topic, but I start thinking about something called social determinants of health. And how do we really get to the underserved? The underserved aren't necessarily just people who have poor health today. They're people who have poor nutrition today, or people who don't have access to transportation or don't have access to housing. And so in order to really know who the underserved are, we've got to dig deep. We've got to dig deep and understand where they're.
So that's a bigger picture than just whether or not somebody walks into your building with a high temp, right, Rhonda? That is a picture that looks at housing, that looks at quality of life.
A child with a stomach ache might not need a CAT scan, they might need a meal.
That's interesting, and you look at that as a overall picture of Lima and the greater Lima's community health.
Yeah. So we're not there yet.
But that's a big.
But that's what we need to get to.
But having said that, though, you have your pulse on a big. You can affect, Rhonda, as president of Mercy Lima Region. You can affect Lima's quality of life more so than probably any other CEO in the area.
I hope so.
So you're the largest employer. How does somebody like you, who has risen from Ohio Northern, how do you manage that type of operation and still make an impact?
Yeah. So I think a couple things come to mind when people say, "Oh my gosh, that's a really big job. That's a really big." I smile and go, you haven't met my team. You haven't met the team. And it's bigger than St. Rita's. The people in our communities and the people that are working with Mercy, whether it's a physician practice office or an urgent care or in Putnam County, it's that collective approach.
But I think it's important, Rhonda, that leadership matters. And I hear that some of the feedback I get. So when people talk about who's the new president out there in Mercy Health, who's that person who is now in charge of how the quality of life in Lima, Allen County is going to be affected. They look at you now, right, Rhonda? They're going to look at you as the leader in that, and we want to know from a big picture, what does Rhonda think about Lima, and how does Rhonda come into the perspective of saying, I can make Lima a better community? I
hold myself to a really high standard, and that probably won't come as a surprise to people who know me the best. And all I can say is I take a very personal approach to every encounter. I treat and interview and collaborate with people like it was my own loved one whose life depended on it, because it does. And so I think about, and where I try to portray that leadership is that every interaction counts, whether it's in the community, whether it's how you are treating someone you pass in the hallway. There are so many needs, and so I try to lead first and foremost by example. And I try to recognize, too, that it's always personal.
Do you feel overwhelmed at times, Rhonda, given that the community looks at Mercy Health as a leader in the community in a number of different ways?
Yes and no. I sometimes feel overwhelmed because I want so desperately for it to make that impact. I care so much. But in another way, I don't, because it's people like you and people like Angel and people that are in the community that when I see them, they are such support and they are so much on the same page of wanting the best for this community that I don't ever feel like I'm alone in this. And that's really reassuring.
And I think the community, and I don't want to beat this to death, but I think it's important for the community to understand when our community has local leadership who has gotten to know, using that bad grammar, how the people are affected by your decision, it helps. Let me throw a curveball at you, Rhonda. One of the things, Dr. Lehman, that comes up in the whole dialogue between the healthcare services provided in Lima and the greater Lima region is collaboration. Is there a chance, or will there be an opportunity that, and again, I know this is a complex question, is there or will there be more collaboration between Lima Memorial and Mercy Health as it was in the past? And I know that's a tough 15-second question.
It's a tough one. I think that you know, as it stands today, there's not a lot of overlap. There's not a lot of collaboration between those. Could there be somewhere in the future? Perhaps. Mike and I have a good relationship and speak occasionally and about topics, and I think that that's a positive kind of first step.
Can I ask you this question?
Sure.
Is the community better served with collaboration with one heart center or with one relationship with neurosurgeons? Does the community better served in the size of Lima? Could I ask you that?
You can ask me, and I would say it's probably up to the community to decide that.
That's a good answer.
Thank you.
In terms of whether or not we feel that that it's served.
Absolutely.
That position, though, Rhonda, I think is going to be really interesting as this whole healthcare evolves. And I think you alluded to it now, that it is something that is moving continuously as we look at ways to better serve the population.
Yep.
I'm going to make sure, though, that the community gets to know not only Rhonda and how Dr. Lehman has come to be the president of Mercy, but just overall where the healthcare model is going in the Lima community and how people in all sectors of this region are affected by this change.
Yep.
And when you bring Lima into perspective, does Lima rank with when you go back and do benchmarks, how is Lima in terms of its healthcare needs being met?
Lima does extremely well as far as the healthcare services we're able to provide. Are we meeting all of the needs of our communities? No, of course not. And I think so 2 questions maybe you're asking, and maybe I'll answer both. So how are we doing as far as how we rank in delivery of healthcare services compared to other organizations? Extremely well. Our patient experience is the highest it's ever been today as I sit here.
Good.
In the emergency department and in the inpatient setting. Doesn't mean there's always not room for improvement. But some of the recognitions we've gotten, the magnet accreditation.
And I answer that as we get to a break, and I want the community to know that Lima has one of the best, particularly coming out of Mercy Health. I can speak to that one.
Without a doubt.
Services. Follow me, Rhonda. You don't always have to travel out of town. When you have a president that's sitting in front of us and talking about those types of numbers, it's one of the things that the community can be proud of. We're going to take a break, but when we come back, Rhonda, we want to ask you about this new project that's going on downtown Lima.
Excellent.
How Dr. Lehman is going to lead us to that project.
Sounds good.
From early in the morning when the Happy Days stores open, turn the grills on, get the coffee turned on. Across town, the beer barrels, there's a lot of prep work that has to be done. Sauces being prepped on the stove. At Old City Prime, everything's from scratch. I think the culture in our company is that we care about our people. And in return, our people care about our customers. Thank you so much to all of our team that's worked for us, and thank you so much to all the communities that we're in for being such great customers.
Our barbers and cosmetologists are licensed professionals who specialize in all phases of hair. Whether you are getting a line-up, cut, beard trim, or design, our barbers will help create your unique style. With full-time cosmetologists, also taking appointments and walk-ins from lashes, presses, color, wax to braids, and weaves, Fresh and Faded Cosmetologists do it all. Call us for an appointment today. Fresh and Faded Unisex Hair Studio, the largest shop in Northwest Ohio. 419-221-FADE.
If you ain't fresh, you ain't faded.
Welcome back. Hello, Lima. It's certainly a pleasure. I've been talking to Dr. Lehman and some of the things that are going on with the Lima Hospital. I call it the Lima Hospital. Listen to me, the Mercy Hospital, the Mercy Health. Having said that, Rhonda, the community is not only excited with your leadership and what could possibly be one of the biggest changes to come to the community, and I really believe that, because local leadership matters, and there's a lot of positive feedback coming from you sitting in the hot seat. I'll call it that. But certainly, if you drive down Market Street, you see some excitement coming under your leadership already, and that is a nice building. We're going to take a look at that building, that construction that's happening, and have you talk about that when we come back.
Perfect.
And remember, Rhonda, as we watch that, since there's not a lot of narratives, tell us what we're watching there. Can you talk a little bit about that building?
Yeah, so this flyover is showing the new Graduate Medical Education Center that'll be located at the corner of Market and Collett, the GME building.
GME.
Building is going to be home to the 4 physician residency programs that we have either had approved or in the process of getting approved to bring to the community.
And the Lima community keeps asking questions. What does that mean in terms of its impact on healthcare? We know what that beautiful building is going to do. It is certainly going to change the landscape of downtown Lima. But how does that building impact somebody walking in for services at Mercy, Rhonda?
So we got to start with the program itself. And we've got 4 residency programs that'll be starting: internal med, emergency medicine, family medicine, and general surgery. 3 of those 4 have already met all the requirements and are approved. And actually, we're recruiting our 2nd class of family med physicians right now and our 1st class of internal med.
And they'll be housed in this building?
And they will use this building so they'll be seeing patients, so there'll be no patient care in that building per se. But that building is for training purposes. And the lower level will be used for study, collaboration, some research. The 2nd floor is going to be exclusively a simulation lab.
Is that right?
Where we're going to be using the state-of-the-art simulation where physicians can practice line insertions, intubations, all these complex procedures before they're actually doing it on a patient. And then there's also going to be a 250-seat auditorium in there. And that's where, when you're talking about how do we collaborate with other community leaders, where we're just having a lot of fun talking to everything from high school career programs to Rhodes to Ohio State Lima, about how do we collaborate with them, even the EMTs and paramedics in the community, to create a educational environment where physicians are learning alongside the people they're going to be working with day to day.
Wow, I don't think people realize the impact that's going to be, not only in terms of the I use that verbiage again, the landscape and the way it looks and how it's going to change the beautification of downtown Lima, but you're talking about some exciting programs in that building that's going to affect the community in a number of ways, including collaborative training methods.
Absolutely.
How did this happen? How did we get so lucky?
So I got to give some credit where it's due, of course, because there's always people that are at the beginning of those ideas. And Dr. Kevin and his wife, Dr. Lisa Casey, moved to Lima several years ago, and they had moved here from the Pennsylvania area, but they were Ohio natives. And they really, in their first few years at St. Rita, said, you guys have something really special here, and we think it's special enough we should be training physicians. And the really awesome part, I think, about what we're going to be able to do when we train physicians is not just train them to be incredibly high quality physicians, which they will be, but we're also going to train them to deliver care in the mission-oriented way that we intend to deliver care, that makes us unique as Catholic healthcare in the United States.
So these physicians, Rhonda, are going to be coming from all over?
Absolutely. The first class is already with us of 6 doctors. They started in July, and so they're already starting to progress through their rotations and their training. Yeah, they're coming from all over, but we are paying attention to where people are from and where they want to eventually practice, because we do want to be a feeder to the physician shortage that we're experiencing now.
Yeah, and I want to talk about this without muddying up the community's brain. So having said that, there's going to be regular practice going on at the same time, which means your general surgeon, your general practitioner is still going to be performing just like normal, Rhonda.
Absolutely.
And there's going to be training going over at the same time. So nobody's going to be used, and you hear me out, there's no testing going on patients.
Absolutely
Clear that up, Rhonda.
not. Absolutely not. So these are physicians. They have actually already finished medical school. So now they're to the specialization part of their training. So they're already MDs and DOs. They're already physicians. They are in the specialization part of their training. So they've done undergrad.
Rhonda,
they've done 4 years of med school.
These guys are
They're
at the top.
doctors.
They're at the top of their game, getting better.
Yes, exactly. Now they're focusing on, I want to be the best general surgeon or the best family physician, the best internal medicine physician.
Rhonda, I don't know if a lot of people know that.
Yeah,
Follow me?
yeah.
So there's not only going to be practitioners delivering services, there's going to be a higher training in the most latest technology in the Lima community.
And when you have people around our existing physicians who are excellent providers, they're challenging them. The next generation is great at asking questions, challenging. It's going to raise the level of quality for everyone, regardless, just because they're here training.
Wow, and I don't want to sound like wow, that's just mind-blowing, but at the end of the day, Rhonda,
that's how exciting it is.
I'm thinking though, Rhonda, a lot of people don't know the kind of impact that's going to have on the community, because there's some thought that is just going to be a place where people come to train, but you go elsewhere to get your really high-level surgery, but that's just the opposite.
It is just the opposite. And I would also share that even though those are the 4 programs that we're focused on training.
Tell me those 4 again, Rhonda.
Family medicine, internal medicine, emergency department, and general surgery. So even though we're training in those 4 areas, we've already started to see, as we're recruiting doctors, there's collective excitement, because a lot of physicians, even if that's not their specialty, love to teach and love to train. So maybe a nephrologist or a urologist or someone else says, ooh, I want to be a part of an organization that does teaching and training, even if they're not training my specialty,
Right.
because they enjoy being a part of that environment.
Wow, that is exciting. But having said that, as we stay on this topic, because I think it's important, the quality of Lima is going to improve in terms of not only the education, because you're talking about whether, and you mentioned it, Rhonda, whether it's the UNO students, or whether it's the Rhodes students, or whether it's the OSU Lima students, or even some of the high schools who have what they call career professional programs in the healthcare field. That all is part of that new building that we saw on the screen.
We want to collaborate with those folks, and we've already met with almost all of them, talking to them about how can we partner? What does that look like to your curriculum? How can we make sure we're not duplicating services, and how do we bring those folks together to train?
And that's a 250-seat auditorium that's going to be in that building.
Correct. And we want it to be used by more than us. We want to be holding education and holding speakers that the community wants to come in and listen to.
And some of these practitioners, some of these physicians, Dr. Lehman, may stay in the Lima region.
Glad you asked. Approximately 40% of physicians that train in a particular geographic area will choose to stay there. And the neat thing is, I think for our community, is we're not going to be able to hire all 40% of those. We recognize we'll be training physicians in Lima at St. Rita's that may go on to practice at Lima Memorial, that may go on to practice at Wilson and Sydney, that may go to Van Wert, that may go to Salina. That is the greater regional impact that this program is going to have. We fully acknowledge that, and we believe that a high tide raises all ships.
Absolutely, that is excellent. So when is the building going to be done, Dr. Lehman?
Well, we got started first.
Yeah.
So tomorrow morning, 10 a.m.
Tomorrow
Tomorrow morning, 10 a.m. is the official groundbreaking. Really excited about that, and we expect to have it completed by about December of 2020. So a little over a year.
Yes, and
about 13 months.
And you can still see some of the influx of that already with some of the physicians
site prep
practicing.
is happening. Yeah, yep, exactly.
And I think though, Dr. Lehman, I want to make sure that the community is aware of this, because I think it's important for the community to be aware of this. Those physicians and that services that they're going to deliver improve the quality of life of consumers walking and talking around the Lima community who are going through medical conditions, right?
That is the driving
And that's
force.
probably the big force that you've talked about.
Absolutely.
Give me a little insight on that, though. How when you talked about the statistics, though, those of us who are suffering and talk about it could have a medical condition, we're going to get some pretty good services locally.
Absolutely. So I talked a little bit about some of the recognition we've received and our quality of care, and we measure, and it's very interesting to me because how the public measures quality versus how we in healthcare measure quality are very different.
Absolutely.
But equally important.
And I want to say this quickly. People in communities and how communities grow is critical that we have access to quality of healthcare. Follow me, Rhonda?
Absolutely.
Those communities that are growing outside of the Lima region all have, whether it's the Cleveland Clinic or whether it's the James Cancer Center in Columbus, they are attracted because of the quality of healthcare. And we're going to talk a little bit more about that, but we're also going to be met with Angel Common and talk about a great program that Mercy is putting on in collaboration with the local high school.
We at Lima Pallet Company thank you, Lima. In 1977, we started a small family business, and today we continue to grow. Lima Pallet is a full-service pallet and crate provider. Every customer is unique, which is why we build pallets and crates to our customers' specific requirements. Because we have our own fleet of trucks, we're able to provide customers with on-time, same-day, and 24-hour emergency deliveries. Coming together is the beginning, keeping it together is progress, and working together is success. Let's continue to succeed.
The loss of a loved one can leave you with a lot of unanswered questions, feelings of stress and anxiety, and grief that makes events difficult to handle. The experienced funeral directors at Jones Clark Funeral Home will guide you through the aspects of the funeral service with compassion, dignity, and respect. Our staff of dedicated professionals is available to assist you in making funeral service arrangements. The funeral directors at Jones Clark Funeral Home provide individualized funeral services designed to meet the needs of each family. Call us today to pre-plan your funeral.
Hello, Lima. Welcome. Angel Collins with us. Welcome, Angel. We're going to hear about your program because I love that program and the numbers that are coming out of that program. That is, let me ask you a quick question, Dr. Lehman. Is there a possibility of additional physicians locating through the, I'm excited about that. Can you touch real quick on the number of physicians that could be impacted with this new teaching hospital?
Right. So the 4 programs we've talked about, they're multiple year programs. So you'll have someone in the first year, or you'll have a class of physicians in the second year and the third year. That will compound over time. And so we expect, though, it to be close to 100 physicians, new physicians in our community in this teaching program within the next 3 or so years.
Okay, back that up. How many again, Rhonda?
100.
Over a 3-year period,
Yes,
that could be mingling in our community,
because they will
growing?
be in their various stages and various classes of residency.
Wow, that is super exciting. And Angel, you have a great program that kind of mirrors some of the dialogue that we've talked about, the training.
Yes.
Can you talk a little bit about your program, Angel? Because I think what Mercy does and the impact Mercy has on the community is applauded. And certainly having Dr. Lehman as a new president, it's only going to get better. Tell me about your program, Angel, and how it's impacted the community.
Okay, it's the summer youth program that's with Mercy Health and Lima Seniors high school students. And there's students that are selected through a rigorous application process. They have to have a 3.0 GPA or higher to get into this program, and they are interested in the healthcare field, and that's how we select students. And they're in the program for 8 weeks during the summertime, and they get to rotate throughout the hospital in different jobs.
And these aren't, Angel, just kids going over there running in the cooks and laundry. These kids have access to go through a number of different programs at Mercy Health. Is that true?
Yes, yes. Like their first week is just like an introduction week where they do go through an orientation that every employee has to go through Mercy. And then they get to introduce to campus police, and that's just to kind of get a quick scope of how the hospitals run and what they do.
And then they're into all
and
those
then
programs.
They go into like registration and the front desk, and then they go into other
Angel,
areas.
since you've been doing it, that's 100% those students have had 100% graduation rate.
Yes, every student that has gone through that program has graduated from high school.
And over 94% have gone to college or trade school coming out of this Mercy program?
Yes, that's correct.
Wow, that is just staggering, Angel. And you need to be commended not only with the collaboration and help of Mercy, but you're affecting that's a number, Angel, that is hard to imagine. 100% graduating through this program.
Mm-hmm. Yes,
and
correct.
And they're going on to college or trade school.
Yes, that is correct. They go through either their Apollo program, they go through Rhodes State, and some of them have gone off to college in other states
and
too.
They certainly have a chance of being employed by Mercy. Is that right?
That's
Angel?
correct. Yes, a lot of them have actually got employed right after the program while they're still in high school through Mercy.
Wow. I mean, it is exciting to see kids who have an opportunity, follow me, Rhonda, that can just stay home, stay in this region, and get associated with people like you, Angel, who are doing yeoman's work to say, hey, here's an opportunity for you to stay in the region. Mm-hmm. There's a pay system allowed for them to get a little money, right,
yes.
Angel?
Yes, they do get paid during the summer youth program.
And at the end of the day, many of them decide to stay in this area and become what you call healthcare providers.
Yes, that's unique about the program. We actually collaborate with Rhodes State College too. So the students get to go out to Rhodes, get a tour of Rhodes and the programs they offer, and then Rhodes has actually given us a scholarship for that particular program.
Wow, Angel, I commend you, and certainly the type of work that you do, and I can certainly guess that those guys are going to be on the stage when that new building gets opened up at some point in the day. So we like to thank our guests, man. It's been a joy to hear some of the things that are coming out of the Mercy Health System with the new president, Rhonda Lehman. Angel Cowan, the things that you've been doing over there have been unspoken many years, but we certainly applaud and hearing some of the numbers with 100% graduation rate. That is excellent. We want to make sure that the listeners follow us on Facebook Live, follow us on Instagram and some of the other social media platforms. We'll be live streaming this show. There certainly is a lot of energy behind this show, and we want to make sure that you reach out to us if you have any comments about not only what you saw today, but even in the future shows. Thank you. Hello, Lima.
Hello Lima, brought to you by Good Food Restaurants, home of Happy Days, Beer Barrel, and Old City Pride. Also by Fresh and Faded, Jones Clark Funeral Home, and Lima Pallet Company.